Hello, I'm Dr. Michael Posner, and I'm here along with Dr. Sammy Kareem, and we would like to guide you through the decision-making process of undergoing cataract surgery. You are watching this video because one of your eye care providers has diagnosed you with a cataract. A cataract occurs when the natural internal lens of the eye becomes cloudy, and this can affect the vision in many ways. Commonly, a patient describes difficulty with nighttime driving, difficulty reading, sensitivity to sunlight, or a generalized dullness to their vision. When your symptoms become noticeable and eyeglasses no longer correct your vision, a patient is referred for a surgical evaluation of cataract.
Cataract surgery is a replacement surgery. We are familiar with other replacement surgeries such as knee and hip replacement. Cataract surgery is similar in that we are removing the part of the eye that is no longer working and replacing it with an implant, an intraocular lens. It can be scary to think about having intraocular surgery. However, people are surprised to learn that cataract surgery is actually the most commonly performed surgery in the United States. 4 million eyes are treated annually, and the overwhelming majority of patients are very happy with their vision and pleased with the experience.
Cataract surgery represents an exciting time because not only does your vision improve in the vast majority of cases, but most often the strength of your prescription can be reduced, and often the use of glasses can be eliminated except for the cases where very fine print is needed.
First, we would like to walk you through the process that you will experience when you have surgery. Your surgery itself will be performed by the doctor who is examining you and caring for you during this process. The preoperative care often requires answering many questions and involves some education to help guide you through the choice of intraocular lenses. This often requires a team approach of the ophthalmologist, optometrist, surgical coordinators, as well as technicians. This is all meant to optimize your care.
After you've been diagnosed with a cataract, and we feel that cataract surgery is your best option, you will meet with the surgical coordinators and a time and location of the surgery will be chosen. Most often, the surgery will be performed at the Grandview Hospital Surgical Center in Harleysville. The human eye is quite complicated. Multiple measurements of the eye are needed in order to determine the optimal intraocular lens for your eye. This requires you to come in for specialized testing, and often, depending on the intraocular lens that you choose, you will speak with the surgeon to help guide this decision.
We would like to show you what your experience will be like at the Grandview Hospital Outpatient Center. After registering, you will be greeted by the nurses in the holding area and they will help you prepare for surgery. You will meet the anesthesiologists, the nurses will administer eye drops to dilate your pupil, and you will be greeted by your surgeon. You will be brought to the operating room in which the OR nurses will carefully prepare the area around your eye. About this time, the anesthesia staff will begin to administer medications to help relax you.
We would like to address 3 common concerns. You will feel no pain during the procedure. You do not need to worry about keeping your eye open, and you will not see us working. In general, the only thing you see is a bright light. The operation does not take long, but can vary according to the severity of the cataract. We will take whatever time is needed to perform the surgery to our satisfaction. After the surgery, you will be brought back to the holding area where your vital signs are monitored, you're given a light snack, and family members come back to greet you. Many patients are surprised to learn that they do not have to use eye drops after surgery. This is because the medication is administered internally. This has been proven to be safer for patients and much more economical since you are not spending money on expensive medications. In addition, you will not need to wear a shield. A list of do's and don'ts will be reviewed and given to you for your review.
We have touched on the fact that you have a choice of the type of intraocular lenses that can be placed inside your eye. This will depend upon many factors, but let's run through some instances. Monofocal lenses are wonderful devices that have successfully restored the vision in millions of people around the world. Usually, the strength of the patient's eyeglasses can be reduced with a monofocal lens, but because the lens only has one focal point, eyeglasses are often required after surgery for distance and reading needs.
You may have heard of the word astigmatism. Astigmatism refers to how the outer lens, the cornea, is curved. When the up and down and side-by-side curve of the cornea are different, this creates a blur. So astigmatism results in blurred vision that is corrected with glasses. This is not related to the cataract. At the time of cataract surgery, a toric lens can be placed in your eye to eliminate the blur. Most patients with a toric intraocular lens do not need glasses for distance vision such as watching television. We do expect that you will need glasses for reading and other distances that are closer to you. Your insurance company and/or Medicare pays for your surgery, but insurance does not pay for the additional expense of a toric intraocular lens.
Many times, patients tell us that they just do not want to wear glasses. They do not want to wear glasses for distance, and they do not want to be bothered with reading glasses. There are intraocular lenses available that greatly reduce the amount of time that you will need glasses, both for distance and near vision.
The most exciting option for cataract surgery patients is to use modern technology to reduce the need for reading glasses. This condition is called presbyopia, and all of us are affected by this when we reach middle age. However, at the time of cataract surgery, patients may be a candidate for presbyopia correction to reduce their need for glasses for the majority of their daily activities, whether it be distance vision such as driving, intermediate vision such as computer use, or near vision such as reading a tablet. You and your doctor can discuss if you are a candidate for these advanced technology lenses. Medicare and insurance companies help to pay for surgery, but they do not contribute to the cost of lenses that correct distance, intermediate, and near vision. You may recognize Sue from earlier in the video going through the process of cataract surgery. Sue recently underwent cataract surgery with implantation of a presbyopic correcting lens. We thought it would be helpful to hear about Sue's result.
I made the decision to have the presbyopic correcting lens put in my eye because I've worn glasses all my life. I have bifocals, so I need them for distance and intermediate and near, and I wanted to be glasses free for the most part, and this has done that for me. The first thing I tended to notice is at night when I'm laying in bed without my glasses on and watching TV before going to sleep is I can now see the TV and I can read the small print that comes across the screen. I also, if I wake up in the middle of the night, I can see my clock, I can see what time it is. I currently am still working, so I do a lot of computer work and I'm able to do that easily without wearing glasses. I work with a lot of reports, and most of those reports I don't need glasses for. Only if it's something really tiny, then I may need to wear glasses for a short time, but for the most part, I'm going without glasses all day long. I had my surgery done at the Grandview Surgical Center, and it was a very pleasant experience. They were very organized, they were very friendly, it was very clean, I had no anxiety, and the surgery itself was absolutely pain-free. I felt nothing, and I had a very pleasant experience overall. I'm so happy I made the decision to have this lens put in. The doctor felt I'd have good results with this lens, and he was correct. I no longer have to wear glasses, and it's greatly improved the quality of my life.
This video is an introduction to the process of undergoing cataract surgery. We hope that this helps answer some of your questions, and it might generate more questions. We are here to help guide you through this process.